5 of the deadliest drugs for dogs and cats in veterinary medicine. You may be surprised, but there is a lot of drugs that get used in veterinary medicine. Many of these have side effects, unfortunately some more than others. So these are 5 very commonly used drugs that can have some serious side effects that you're probably not even aware of. Number 1 on our list, the anti-inflammatory drugs, the NSAIDs. Rimadyl, Medicam. Lots of our animals, they're on these anti-inflammatories. But side effects are so common that the FDA, it has its own page for NSAID side effects. These are the drugs that are most commonly used for animals with arthritis. More common reported side effects of Rimadyl: vomiting, diarrhea, ulcers. Other side effects that are seen: liver disease, kidney disease, seizures, and even death. These drugs are metabolized by the liver. They have to be excreted via the kidneys. If your dog has any degree of organ dysfunction, they're at much higher risk of side effects. The GI side effects, vomiting, diarrhea, that's most common. But things like ulcers, unfortunately, that happens pretty often. The anti-inflammatory drugs, such as Rimadyl, they're really harmful and really irritating to the intestinal tract. Clearly, they have a purpose. Your dog is in pain, you want to relieve pain. But if you see some of these warning symptoms, all of a sudden your dog doesn't seem quite right, he's a little bit listless, maybe he's drinking more fluid, maybe he's urinating more often, you need to stop that drug, get in and see your veterinarian as soon as possible. And consider an alternative, something such as CBD, so much safer, potentially as effective. Number 2, we have the flea and tick meds, especially Trifaxis, Bravecto. Trifaxis, super convenient new drug, effective against fleas, heartworm, a whole bunch of the other parasites. You just give it once a month, you don't have to worry about anything. The active ingredients in Trifaxis are spinosad and milbemycin. These drugs are working by affecting the nervous systems of the insects. Unfortunately, they can also affect your animal's nervous system. You can see GI signs: vomiting, diarrhea, anorexia. But then more serious signs: lethargy, depression, ataxia, trembling, seizures. Many dog owners have even reported death. Then we have the class of drugs using Florano, such as Bravecto and NexGard. They're effective at killing fleas and ticks, but they're also responsible for a host of side effects. They're working by inhibiting the nervous system of the animals, the fleas, the ticks. Unfortunately, they can also have these similar side effects in your animals. The FDA Adverse Event Reporting System reports thousands of animals with side effects to this class of drug. I personally would be very reluctant to give my dog Trifaxis, Bravecto. Number 3, new drugs used to treat our dogs for allergies. Drugs like this, Apoquel and Cytopoint. These new class of drugs, they're blocking the inflammatory cascade. Apoquel, for instance, it is an enzyme inhibitor, so it blocks the production of cytokines that mediate the inflammatory response. A Cytopoint, which the company claims isn't even a drug, is actually an antibody which will bind to the cytokine, one called interleukin-3, which plays a key role in the inflammatory response. They're modifying the overactive immune system, which then triggering that inflammation, the itching, the scratching, etc. Seems like a good thing, right? Common with Apoquel, you can see GI signs: vomiting, diarrhea, lethargy, but also much more serious signs. You can see decreased blood cell count, increased susceptibility and risk of infections, an increased likelihood of certain types of cancers. So the thing about Apoquel and Cytopoint, they're specifically affecting a cytokine called IL-3 or interleukin-3. And interleukin-3 is really important for overall immune response. So yes, you can affect an enzyme which decreases this IL-3 production, or you can produce antibodies which bind to IL-3. Great, you stop your dog from itching. But as a secondary side effect, you markedly affect their immune response. There's a host of other options for our dogs with atopy. Start with a proper food trial. Ensure your dog is on a good quality essential fatty acid supplement. Consider some of the alternatives we've discussed, such as this, bioactive quercetin. In my opinion, so much safer in a drug like this, Apoquel. Number 4, the steroids such as this guy, prednisone. The steroids are these anti-inflammatories that are well used in veterinary medicine. Yeah, we use them for allergies. We use them topically for ear medications, topically for eye medications, topically for skin disease, orally to suppress the immune system, i.e. help with autoimmune disease. When I started in veterinary practice, we were always using steroids. A dog came in not feeling well, the veterinarian who was training me said, give him some antibiotics, give him some steroids. And because they're so well used, you would think they can't have many side effects. That is not the case. Most commonly, increased drinking, increased urination, increased appetite. You can see behavioral changes, these animals being more aggressive, excessive panting, stomach ulceration. Increased chance of secondary infections, you're suppressing the immune system. You can see skin disease, these dogs can lose their hair, you can see the distended pot bellies. You can create a condition called drug-induced Cushing's disease. Some animals even become diabetic from steroids. And even if your animal is on it, they're having side effects, you can't just abruptly stop it. You have to slowly taper it and wean it, or that can cause another whole host of problems. I had a friend whose cat was on a long-acting corticosteroid. His cat developed diabetes. His cat had complications of the diabetes. They had veterinary fees in excess of $10,000 from a corticosteroid side effect. So yes, the steroids are really common, but you really need to be cautious using them. Number 5, everybody's favorite class of drugs, the antibiotics. The most common side effects of all the antibiotics are GI signs, vomiting, diarrhea. But they wipe out all that good bacteria, all the good flora within the intestinal tract. And then by doing that, that can make your dog and cat really sick. 80% of your pet's immune system, it's in their intestinal tract. But really common antibiotics can have some serious side effects. The sulfa drugs, such as trimethoprim sulfa, that can cause dry eye. That can cause liver disease, serious skin disease. The fluoxetins, such as Baytril, that can cause neurologic disease. That can weaken the ligaments, make your dog more prone to ACL injury. I happen to be on that class of antibiotic for traveler's diarrhea, and guess what? I tore my Achilles tendon. There's a really common antibacterial antiprotozoal called Flagyl. The name of the drug is metronidazole. Really commonly prescribed in veterinary practice anytime an animal comes in kind of chronic diarrhea, we don't know what's going on, just prescribe some Flagyl. But it can cause serious neurologic disease, especially when it's given at too high a dose. Then on top of all of that, we have the concern for antibiotic resistance. In terms of bacteria that are developing resistance to the antibiotics because they've been overused in veterinary medicine. Fortunately, there's other options. Many times an antibiotic's probably not even indicated. Your cat has the cat flu, it's likely viral. Do not give him antibiotics. Your dog has a secondary skin infection, potentially from an allergy. Why don't you try like a topical antifungal such as Canesten? Because most likely it's a secondary yeast infection. It's not bacterial. The antibiotics are probably not going to help at all. Clearly, conventional drugs have a place in veterinary medicine. There's a time and a place when your dog and your cat, they need to be on them. But beware the side effects, beware the risks. Really closely monitor your pet if they're on them. Then I strongly encourage you to consider some of the alternatives which have lower incidence of side effects. I.e., your dog's been diagnosed with chronic diarrhea, the veterinary says, let's just do a trial with metronidazole. Why don't you consider something much safer such as this slippery elm? Thanks so much for watching this edition of Veterinary Secrets of the 5 Deadliest Drugs in Veterinary Medicine. Click up there to subscribe, hit the bell to sign up for notifications, then when you click that link directly in the box below, I can send you a copy of my free book.